We are here today with Keith Elgart, who is the Chief Operating Officer at Concierge Choice Physicians. He's also an expert in the development of membership models for health systems and hospital groups and large medical groups.
Thank you for having me today.
So let's just get down to it.
Yep.
Why don't you tell us a little bit about how concierge medicine or membership models were working in health systems even before COVID, and what's really set the stage for the growth that we're seeing in the market right now?
Sure. Well, health systems in general are, they're responsible for the wellness of the community, right? They're a servant to the community. And many communities have a variety of people that live in them and want different kinds of services, right? So there's meeting the needs in the primary care setting, in the specialty setting. And there's a number of people, a portion of the population that is interested in more than the standard that is provided. And they want some extra. You could equate it to other services in towns like gyms or other places where people utilize the service. But some people want the personal trainer. They want something a little extra because they want to focus on health and wellness outside of sick visits. And the ability to offer that to the community is an option that should be provided because you're there to meet the needs of that community. And so concierge medicine has become a nice part of that offering. It's just something on the full spectrum of services that should and could be provided. So some health systems offer like a centralized location where they have one core or two core physicians that provide this service for anyone that's interested, while others that we work with provide it more at the community level, down at the primary care level at the office, and meet the patients where they tend to see their own provider. The options and variety that are available are great to meet the needs of the various communities that they serve.
It's like an extension of the services that a hospital would provide. In any case, their primary care, they have urgent care, and then this is just another service level that patients can buy.
Yeah. Their responsibility, again, is to meet all these various needs, and those needs exist, and they have a way to provide it without taking away from other services that they provide. So, urgent care settings are not there to take away from primary care settings. They're there to enhance and provide an alternative that was also necessary in addition to. And this is, concierge medicine is one of those same in addition to.
Do you think that the COVID pandemic has had an influence on the interest that health systems have had in concierge medicine right now?
Sure, of course. I mean, it's been a pretty wacky year, to put it mildly. Everything kind of just shut down. Everyone kind of paused and had to figure out what was going on. How do we interact or not interact? How do we see patients? For a health system, it's really challenging because you have a pandemic going on. They're responsible for the health and wellness of these patients under their care. And everyone stopped for a second and said, wait, we can't see people, right? You have to stay home. We have to stay home. How do you make this happen? And so you saw that quick burst and rise in telemedicine and other methods to stay connected with patients. The beauty for existing concierge practices was there was a very tight connection one-to-one between the physician and the patients already. And so that availability, just in those initial stages, just to allay the fears and the don't worry, we got you. Don't worry, we're working on this. Just sit tight for a minute. Let's all get our bearings, was really strong. And, and again, it's not that the rest of the population was ignored because concierge members got that and others didn't. It just was another extension of what was going on. But as things started to take shape and the high increases of numbers and the things that were going on in that early stage, that big spike, patients, started thinking about their healthcare a little differently, right? All of a sudden, it wasn't just, I go when I'm sick and I need a Z-Pack, or I wait till I'm not feeling well to deal with something. It was I need to be connected. I need to know that I'm taken care of. I want to be a little more focused on what's going on. And so it really tied into health systems looking at what they're offering and could they improve it? Can they create a larger variety of methods? Some of the old mentality was, this exclusivity or this fancy spot that only people with money can go, and they get this better care. And that's not really what it is. And that the philosophy of concierge choice physicians was never that. It's
Right.
never about a separate entrance or a fancier office, or you take away from someone who's a non-member by providing to a member. And health systems really started to reevaluate how they could deliver that spectrum of services to meet the needs that are out there. And the pandemic, it's tragic, it's scary, it's still going on, right? We're still in the midst of we're seeing more vaccinations occur, and that's wonderful. But it really had if you want to say that there's a silver lining, it really made everybody stop, regroup, rethink, and hopefully coming out of this, services provided in health systems and just life in general, people kind of reevaluate and come forward in a new way that better serves everybody, like a real focus on that connection.
So what I'm curious about, though, is if you could explain a little bit about concierge medicine. I think a lot of people are familiar with the traditional concierge medicine, where a practice is completely converted into a membership model and all patients have to join. And that sounds like something that might conflict with the business structure and the business goals of a large health system. How does membership medicine, as concierge choice physicians envision it, how does that fit into the business structure of a health system or a hospital system?
Sure. So, the familiarity that many people have is what's known as the full model, right? Where a doctor, a primary care practice that's affiliated with a health system or independent, might have, let's say, 2,000 patients. And they say, hey, we're going concierge. If you pay this membership fee, you're a part of the practice. And if you're not, we'll help you find another provider. That fits in certain scenarios, that works for certain phases in a physician's career, or what's happening in a certain community, let's say. But for the most part, physicians don't want to break ties with their traditional patients, but they don't want to lose these patients that do want more, or can offer more, or want to contribute financially outside of insurance to health and wellness activities that aren't covered by insurance, right? So the same way you shouldn't take away from a traditional patient, you shouldn't deny this extra that others are willing to go for that isn't necessarily something others desire. And so we really, going back 17 years now, really pioneered this idea of a hybrid approach, where within a standard practice, you don't need to dismiss patients that don't want to be a member. You can dedicate what could be 2.5 to 5 hours per week, which will get you, somewhere between 50 to 100 people who participate, having this, these extended physicals and these activities around health and wellness and preventive care that they would desire during that time. But if you think about the structure of a day, if you're only dedicating, what may be 30 minutes to an hour per day, you're still dedicating 7 hours to the traditional side. So you're really looking at almost 95% or more of your time is still dedicated to the traditional practice, serving the community as it always has. But you have this new innovative way that matches the needs of a percentage of the community. And, a health system is responsible for that healthcare for the community. You'll hear me repeat the word community often, but that's really how I look at it, right? It's a responsibility to the area that they serve, and that, that need varies.
Right, especially today where there's such a vulnerable population that may be separated from family and can't travel. Mm-hmm. So relying on community medicine-based medicine is more important than ever. So
yeah, and having an optional, it's optional, right? That's always the key. Is in that full model style, it's not really your option is to leave, right? In the traditional, in the hybrid sense that we do, the option is to join or to keep things as they are. So you don't end up with this. It's not a 2-tier system in a hybrid practice where, if someone joins, they get more and the other person loses, right? So it's you maintain what you've always been doing, what the patients enjoy and participate in the practice for, but you have this ability to do a little bit extra in the realm of customer service or preventive care and wellness that falls outside of insurance. You're never denying coverage. You're never not going to help someone who might need more because of their current situation they're presenting. It's just the added for those that want it in a general sense for longer term.
So let me just ask very specific questions about the hybrid and how this would work. Assuming, as you said, that a hybrid model only about 5 to 10 hours a week. Is that what you said?
Yes.
Would be dedicated to caring for concierge members, and the rest of the time would be traditional patients. So is it worth it? Is it worth it for a doctor to have such a small program? Is it worth the effort? And is it worth the headache of having to manage both a traditional practice and a concierge practice if the membership is so small? What exactly is the benefit that a doctor or a health system would get, like specifically from a hybrid program within a primary care practice?
It's really not burdensome, right? You're not overwhelming the patient panel you're not pulling in patients from outside for this program in addition to, right? These are patients within your practice who want to use the time they already use in a different manner. So you're not recalibrating your whole day around this influx of people who are paying that were never in your practice before. It's people who are in the practice.
You're actually growing your patient panel. You're sticking with the same size patient panel that you've always had.
Yeah, the foundation of the hybrid program is patients within the program who want this optional service at this time, right? And the beauty of that is that it can grow, it can ebb and flow over time, right? So if it's not appropriate for you as a patient in the moment, but your health needs change over time, you can always join at another time, right? It's not a now or never kind of scenario. And from the practice side, again, your staff, your time as the physician is already dedicated to these patients. And you have patients who desire this service from you. You have the ability to fit it into your day appropriately. You can deliver those services. And, it is for a fee outside of traditional insurance. So you're not dropping insurance. This isn't instead of, this is in addition to. And from a revenue standpoint, for many practices, whether they're part of a large health system or not, it's hard to generate revenue to keep the lights on, to pay the staff, to do all the things that you need to do. Because at the end of the day, physician's practice is still a business, right? It still has to run. We're not in a healthcare system where everything is free and paid for by somebody else, right? So the ability to do this, and those that can contribute and want to contribute for those kinds of services, it helps keep the practice alive and well and healthy for all of the patients, right? So it's got that, some help pay for many.
Yeah, it sort of reminds me of the executive perks that you can get at a hospital. You can elect to purchase a private suite if you're at the hospital, or upgraded food, or that kind of thing. So this is sort of another choice like that within the hospital system.
Yeah, and an easy example, again, it's similar like what used to be on an airplane, right? They have a certain set of seats that are first class. When people pay that much higher fee for that seat, it allows that plane to keep that route running, right? It makes that route work. Now that pilot and that staff, they're still responsible for getting everybody from point A to point B safely at the same time, in the same way, with the same, responsibility towards that. But some people want to pay to get a little bit of a bigger seat and a blanket and a meal and a drink, but not everybody needs that for their 3-hour flight. Some people just want to get to the other side.